Hey everybody, it is Kevin Henry, Editor-in-Chief for DrBicuspid.com. Thank you so much for joining us for another edition of the DrBicuspid.com podcast, and another time that we're going to dive into a product that was reviewed by Catapult. And that's why I'm so thrilled to have on today Dr. Priya Tirumalasetty. Dr. Priya, how are you today?
I'm doing great, Kevin. Thank you so much for having me.
I am so glad you're on, and I'm so glad that you were part of this process and that you helped our readers understand a little bit more about the Shofu Super-Snap Polishing System. So thank you for contributing.
Absolutely. It was my pleasure, actually. It's a lot of fun to use this system.
Well, I want to talk about that in just a minute, but before we do that, I'd love for our audience just to know a little bit more about you.
Absolutely. I have been in practice for 27 years. And it's been an incredible ride. I graduated in 1997 from the University of Michigan and went on to do a general practice residency and then dove into private practice. Started my own in 1999, the end of 99, believe it or not. Seems like eons ago. And I've just done a lot of hands-on in the trenches dentistry. So I try to be very minimally invasive and conservative, especially when I'm doing aesthetic composite restorations in the front. So, I think that I pride myself in just being super conservative and still putting out a really nice outcome for my patients.
That's awesome. Well, I know, you tipped your hand a little bit that obviously you're a big fan of the Shofu Super-Snap Polishing System. And we're going to link to the article. If you're listening to this, the link to the article will be in the show notes. And obviously, if you're watching this on Dr. Bicuspid, you're already in the article. So you can read all about what Dr. Priya had to say and the case that she provided. But I'm curious, what was it that stood out to you about this product?
So I actually have the product here, and they come packaged in little singles. So you have like all the discs in one little pre-wrapped package, and they also come wrapped in a giant kit, and you can also order individual parts and pieces of the kit too. So it's really nice to kind of have all of it together. You're not scrambling to put it together before a patient comes. It could be as easy as just dropping a little pack of the singles on a tray and then you're ready to go. They're also color coded, which is fantastic because I'm very visual. When I'm in a hurry, I know that there's different colors associated with each grit. So once you familiarize yourself with the color coding system, then it's just grab it and be done. And you might jump out of sequence and you know what you're going to get. So once you get familiar with it, each little disc has a different grit. And my absolute favorite thing, I would say what stands out, is that there's no metal center attachment to the disc. Now, those discs are there as well, and they're terrific, but there's times where I really don't want a metal hub in the middle, especially if I'm laying my disc flat on a restoration and I'm polishing flat. I don't want to nick or, divot my composite with that gray little center. So when I know that I want that ease of use, then the Super Snaps come in really, really handy.
It's funny. I was just going to bring that up because that was one of the things whenever I read through your article, I never thought about the importance of not having that little metal ring in the middle and given that wider surface and how important that might be.
Yes, and it's also harder to snap on that center hub. You really have to get it in the right kind of space, and especially if the disc is really thin and flexible, you could bend and warp the disc while you're trying to snap it on the metal hub. So you don't worry about any of that. It's so easy to slip these Super Snap discs onto the mandrel, and it's a no-brainer. Especially when you're trying to get through a case or a procedure, it's just easy. And I'm all about that. It's predictable.
It's easy. And like you said, when you're in a rush, that's a great thing to not have to think about one more thing. That's always a good thing.
Yep, exactly.
One thing that was said in the article, and I wanted to get your thoughts on this, was the Super-Snap system is also very useful in developing and modifying the anatomy of crown and implant provisionals. And I just kind of wanted to get your take on why that's important and why clinicians should be thinking about their choices like the Super-Snap in those scenarios.
Sure, absolutely. So I love to make sure that when I'm fabricating an implant provisional, I'll use a custom titanium abutment. And there's kind of like a metal margin where you want to have a really nice, smoothly contoured restoration come up to. So I'm oftentimes doing the body of the provisional in acrylic, and then I'll reline the neck with composite. And so there's, kind of a multi-material restoration going on because I want to have a nice smooth emergence for my tissue to settle around. So if I'm not having a lab make it, and I 99% of the time make my own provisional for implants, then I need a really highly polished smooth finish. And so that transition from the metal hub down to the emergence of my actual Pontic or provisional needs to be nice and smooth. So I find, again, the ease of use with these Super Snap discs that I could just put a disc on there and start contouring with that. It's also great because in that disc they have little one gloss points, two separate product, but as a system, it's really nice to go through that series to polish my implant provisional before I seed it so that I know that I'll have healthy tissue.
And I want to read just one more part of the article. And again, if you're listening to this, it's in the show notes. And if you're watching this, well, just scroll up and you'll be able to see it. The majority of evaluators from Catapult felt that the disc system significantly improved their workflow efficiency and patient outcomes. And I will tell you, one thing that I'm hearing so much right now is about efficiency and workflow and how those come together. And I know we think about the digital workflow so often, but this seems like another workflow that is really important for clinicians to keep in mind whenever they're going through such a busy time in their practices.
Absolutely. So we all have our own little ways of polishing resins, and your little armamentarium could be, a series of stones and then discs and cups and things like that. And with a system like this, again, it's color coded. It could be prepackaged if you wanted. And one quick thing is that you can have double-sided or single-sided with this system, which is not an option with any other system that I've seen. And in all the years I've been practicing, I've used them all. So it's really great because they have there's a safe side down and then there's a double-sided, which is really unique to Super Snap alone. And many of the other disc systems don't have the option to have double-sided versus single-sided or safe side down. So once you're familiar with the system, let's say that you are contouring a line angle on a composite, but you don't want to take away from the adjacent tooth or nick it at all, then you can just go to town with your safe side down disc, which is the black disc, or they also have a safe side down for the violet. And then the violet, green, and red also have a double-sided. They're all double-sided. So then you could flip that disc around. You can use the underside or you can use the top side. Once again, creating just, a nice workflow and increasing your efficiency so you're not having to flip the disc, take it off the mandrel. So it's something that it's just a really useful tool. And I do a lot of chairside composite veneers, and I love to be able to grab, whichever disc is appropriate, and it's right there, easy on and off. So great.
Well, that's fantastic. Ease of use, so many good things that you've talked about. And again, I want to encourage people, check out the article and a fascinating case on there, as well as some other things from Dr. Priya and the other evaluators from Catapult that you can learn more about this product and what makes it so great. So Dr. Priya, thank you so much for your time today. I really do appreciate it.
Thank you so much for having me. It's a delightful product, and I loved testing it out and being able to speak about it.
There you go. What more needs to be said? That's fantastic. So now we so enjoy our relationship with Catapult, and we so enjoy bringing you products that other clinicians have tried and have approved as well that are going to help your day be a little bit better as well. Until next time, it's Kevin Henry, Editor-in-Chief for Dr. Bicuspid, signing off, and as always, wishing you nothing but success.
Thank you.